Live again. Sympathetic and parasympathetic. We've talked to a certain extent about pupil function. The pupil function, the normal hippus, HIPPUS, the constriction dilation, which by now you should be conversant with the factors that influence the size of the pupil, and those being predominantly accommodation and the amount of ambient light that's in the room. And pupil size, which is a function of both a control of the amount of light that goes into the eyes, as well as uh, aiding in producing the best visual acuity through a control of sort of depth of field of what you see. The pupils are controlled by the sympathetic and the parasympathetic pathways. I will attach a little printed material which has text as well as pictures, drawings to aid in our understanding. The pupil is innervated by the sympathetic and parasympathetic fibers. Pupil dilation is mediated by a 3-neuron sympathetic pathway, which has its origin in the hypothalamus in the brain. The first order neuron descends from the hypothalamus to the first synapse. The synapse in the cervical spinal cord in the C8 to T2 region of the spinal cord called the ciliospinal center of Budge. Cilio, C-I-L-I-O, spinal, one word, center of Budge, B-U-D-G-E. The descending sympathetic tract, nerve fibers, the tract of nerves, is in close proximity to nuclei in the brainstem, to give you some perspective. The second order, which is still preganglionic, is now destined for the head and neck, and it exits the spinal cord and travels the cervical spinal chain over the apex of the lung and synapses at the superior cervical ganglion. The superior cervical ganglion is located near the mandible or the jaw and the bifurcation of the common carotid artery, which is in the neck. The third order neuron, which is now postganglionic, because we have synapsed in the superior cervical ganglion. You'll remember just scant moments ago that the first order descends from the hypothalamus to the cilio center of Budge. It does not say that there's a ganglion. It just says it's where the first synapse occurs. But the second order, which is still preganglionic, ascends from the ciliospinal of Budge to the superior cervical ganglion, and then there is another synapse. But now the third order neuron, which is postganglionic, enters the cranium along the internal carotid artery and into the cavernous sinus. And here, the oculosympathetic fibers exit the internal carotid artery in close proximity to the trigeminal ganglion and the sixth cranial nerve right there in the cavernous sinus, which is behind the orbit, and joins the first division of the trigeminal nerve to enter the orbit. The first division of the trigeminal nerve, as you will remember, is the ophthalmic V1 division of the trigeminal nerve. The long ciliary nerves, fibers with the long ciliary nerves, innervates the dilator muscle of the iris and Mueller's muscle in the upper and lower lids. Pupil constriction is produced by the parasympathetic cholinergic fibers that travel with the third cranial or oculomotor nerve. The parasympathetic system is a reflex that controls the diameter of the pupil in response to the intensity or the luminance, the amount of ambient light that falls on the retina, and stimulates the pupil fibers of the eye, thereby assisting in adapting to various levels of lightness and darkness. The greater the intensity of the light that enters the eye, the more the pupil constricts, or the more miosis occurs, which allows less light in, and lower intensity situations causes the pupil to dilate or undergo mydriasis, allowing more light in. Thus, the pupillary light reflex, which is a combination of the sympathetic and parasympathetic systems, regulates the intensity of light entering the eye. The pupillary light reflex pathway has an afferent limb, which travels along the cranial nerve 2, or the optic nerve, and the efferent limb, which travels along the cranial nerve 3. The ganglion cells of the retina project bilaterally to the pretectal nuclei. The pretectal nuclei project crossed and uncrossed fibers to the Edinger-Westphal nuclei, Edinger-Westphal, Westphal. The pretectal nuclei projects crossed and uncrossed fibers to the Edinger-Westphal nuclei, which gives rise to preganglionic parasympathetic fibers. These exit the midbrain with cranial 3 and synapse in the postganglionic parasympathetic neurons in the ciliary ganglion, which innervates the sphincter muscle of the iris. So the ganglion in the sympathetic system we've discussed as being the superior cervical ganglion, which is located near the mandible and the bifurcation or splitting of the common carotid artery. The postganglionic sympathetic fibers are neurons in the ciliary ganglion, which is inside the orbit near the lateral rectus muscle. So we have this multiple neuron arrangement in both the sympathetic and the parasympathetic pathways for pupil function. In the parasympathetic system, we have this ganglion cells in the retina to the pretectal nuclei to the Edinger-Westphal nucleus, the efferent pathway coursing forward along the third cranial nerve, and then having a ganglion, a parasympathetic ganglion, in the ciliary ganglion inside the orbit. Next page. The ciliary ganglion is a parasympathetic ganglion located just behind the eye in the posterior orbit. It measures 1 to 2 millimeters in diameter, so pretty small, and the human ciliary ganglion contains approximately 2,500 neurons. The oculomotor nerve coming into the ganglion contains preganglionic axons from the Edinger-Westphal nucleus, which form a synapse with the ciliary neurons. The postganglionic axons run in the short ciliary nerves and innervate the two eyes. The pupil sphincter pupillae constricts the pupil, a movement which is known as miosis. The opposite, mydriasis, is dilation of the pupil. The ciliaris contracts, releasing tension on the zonules of Zen, making the lens more biconvex, also known as accommodation. Both of these muscles are involuntary. They're controlled by, you know it, the autonomic nervous system. The anatomy. 3 types of nerves run through the ciliary ganglion: parasympathetic fibers, sympathetic fibers, and sensory fibers. Only parasympathetic fibers synapse in the ciliary ganglion. The other fibers just run through the ciliary ganglion without having a ganglia in. Trying to see if there's anything else here that we want to cover. Okay. So from the standpoint of text, that's what we want to cover from these pages. I sent you some drawings. There's the more important aspect of this drawing of the vertebra is that it's kind of out of focus. That's not a point, but it is kind of out of focus. But what it will show you is that the cervical vertebra are at the top, the thoracic, the lumbar, the sacral, and the coccygeal. And a throw in there is the level of injury or the possible extent of paralysis if there's trauma in differing parts of the vertebra. The final page, the back page there, shows a nice drawing of the sympathetic and parasympathetic pathways for pupil dilation and constriction. And at the bottom, we see a much enlarged representation for the ciliary ganglion, which is in the area of the lateral rectus muscle in the orbit. And we can see the roots of fibers that pass through nervous fibers that pass through the ciliary ganglion. And we can see that toward the bottom where we see parasympathetic fibers, we see the little representation of the synapse that occurs. And we see that the other fibers, which are sympathetic and sensory fibers, pass through but do not synapse in the ciliary ganglion. So have a good day. See you tomorrow.